subscription model is the best way to allow patients to have essentially unlimited access, for a better term, high levels of access. They can come back when they want. There's a doctor essentially in the home of those families 24/7, especially in COVID. What we've learned is that this is a really reassuring thing for families, especially families that have a member who's COVID positive.
And it allowed us to just, rather than say, hey, we've got to get, quick ramp up, build new clinics. Instead, we said, let's use the tools of the 21st century and deal with this pandemic in a very different way than we did in the 1918 flu pandemic. And it actually allowed us to think differently and to reimagine what healthcare could be. And so now we're really thinking about patient journeys across the spectrum and redesigning our system in a healthcare 2.0 world to be much more seamless, easy for both the patients and the caregivers themselves.
A lot of people approach it as like, well, let's try to do what the doctor does, and we try to replace the doctor's brain. And I think those are fun experiments, and if we can do that really well, that's going to be very helpful one day. But I think sifting through the mountain of data, combing through the overwhelming data that's in the health record, the traditional health records, and being able to pull out the actionable pieces that's helping the doctor and the patient, I think, kind of get down to the work that needs to be done.
As the healthcare system is changing, providers also have more choices about the ways in which they deliver care. And we have to become a desired employer for those providers. We have to provide them with the tools and innovation that make us the place that they want to provide. They feel that they can provide the care that they're trained to do, and they can do it in ways that are innovative and cost effective for them and convenient for them.